My name is Dr. Bowles and I am a neurologist in private practice. Welcome to our video on what happens to the patient in the ward or ICU after being admitted from the emergency unit. Understanding this part of the process is helpful for the family to be empowered and gain knowledge about what is going to happen, and also to be calm and also provide support for the patient while they are going through the stroke recovery process. Once a patient is admitted from the emergency unit to a ward or ICU following a stroke, they are met by the admission nurses who will take down vital information from the family or the patient, him or herself, which includes past medical history. They'll take down contact details from the family so that if there is a problem, we can properly communicate with the family. They will also then immediately initiate the treatment plan that was started in the emergency unit. You may also find that additional investigations, for example, blood tests, chest x-rays will be done, and in some cases, a nasogastric tube may be placed through the patient's nose into their stomach to allow for safe swallowing and adequate feeds. Following this, the patient will be met by a myriad of different healthcare professionals. This will vary from the nurses to therapists to the doctors themselves, as well as a dietitian. These members together form a specialized unit called a multidisciplinary team, and they will be in charge of the patient going forward with ongoing care, updating the family on the progress, and ensuring good recovery. A physician, typically a neurologist, will lead the multidisciplinary team. They may consult other specialist doctors such as a cardiologist or specialist physician should it be needed for advice or management of other complex medical disorders. As explained earlier, the rest of the team will consist of therapists, a dietitian, the nurses, and even a psychologist at times. Once in the ward, the nurses are responsible for monitoring the patient's condition. They will do routine vitals, which is the blood pressure, the pulse, the oxygen saturation. They will also make sure that the patient does not decline any further from the stroke, complications of the stroke, or from other medical conditions. They will ensure that the prescribed medication, as well as the patient's chronic medication, if appropriate, is given in the correct time and in the correct, safe manner. At this point, this is the first step of the rehabilitation process, and the therapists, such as the speech therapist, occupational therapist, and dietitian and physiotherapist, will all review the patient and be in contact with the family. What will happen is that they will do a baseline assessment of what the actual deficit of the patient is. They will compare it to the previous reported baseline functioning of the patient, and then they will discuss with the family and the patient what the expected outcomes will be and what the mutual goals will be for the recovery process of the stroke. Nutrition is a vital component of the recovery of a patient. It is therefore important that the dietitian is involved. You'll find that a dietitian will prescribe a very distinct meal plan that will be tailored to the patient's needs, ability to eat and swallow, as well as the findings of the blood results. This will ensure overall rapid recovery as well as overall health and well-being of the patient. The goal of stroke care at this point is to ensure that the patient is medically stable, to prevent complications from the stroke, and to allow us to initiate the first stage of rehabilitation. Once this is complete, the patient will then be transferred to a rehabilitation unit or a step-down facility to continue into the next phase of rehabilitation. I hope this video helps you understand the complex process that happens once the patient is in the ward. You may come across a lot of people, it's busy, it's hectic, but hopefully this will just give you some insight into understand what is going on and also allow you an opportunity to ask the questions that might be crossing your mind.